Did you notice that some people are more sensitive to pain? Why do people feel pain differently? In this video, I will explain what are the factors that are involved in these differences. But the main point I want to make in this video is the following. Is it possible to increase or decrease pain tolerance? Can we do something to change the way we tolerate pain? Can we teach our children to be more resilient to pain? Can we change how much pain we feel just by changing our pain thresholds and pain tolerance? The answer is yes. Today, I'll answer these questions and explain some exciting new research about how we can increase or decrease our pain sensitivity, and that does not involve drugs. So let's talk about pain sensitivity today. First, let me define two concepts that pain scientists use to study pain in laboratory: pain threshold and pain tolerance. Pain threshold is the minimum stimulus that causes pain. For example, what is the minimum pressure that I have to apply to your skin? And you will say that instead of pressure, you start feeling actual pain. In laboratory, scientists use a variety of stimulus like a hot pan, and they start increasing the temperature. Then, when you say it's painful, then that's your threshold. They can also gradually decrease the temperature to the point that you say this is not just cold, but it's actually painful. So scientists use this kind of experiments in laboratory to measure pain thresholds in various individuals, males, females, younger, older, or the same individuals but under different circumstances or different days. The other concept is pain tolerance. This is the maximum amount of pain that a person can handle. So if we use the pressure as an example, I continue applying pressure to your skin. This will put pressure on the muscles, and I increase the pressure more and more and more and more, and there will be one point that it will tell me, stop, I can't take it anymore. Or if the scientist in the laboratory keeps increasing or decreasing the temperature of the probe, you will say, stop. That is unbearable. When we say someone is more sensitive to pain, this can be because they have a lower threshold or a lower tolerance. And that is true. Different people have different sensitivity to pain. And even the same person will demonstrate different sensitivity to pain on different days, depending on various factors. Well, please remember that this video is not intended to give medical advice. If you have a condition that is causing pain, talk to your doctor for a diagnosis and individual care plan for you. This video is for educational purposes only. If there is a medical emergency, please call an ambulance or go to the nearest emergency department. So let's see what affects pain sensitivity. First, let's see sex differences. In general, women are more sensitive to pain than men. In laboratory, we observe that men requires more intense stimulus to feel pain. So there might be some genetic differences that predispose a person to be more sensitive to pain. But it's not just genes. It's also related to hormones, function of the pain system, psychological and social factors. Take hormonal factors. Almost every woman knows that the pain sensitivity depends on the menstrual periods. A few days before the woman's period, they are more sensitive to pain. Try waxing a few days before your menstrual period and compare it with the pain you feel if you wax a few days after your period has ended. There is very noticeable changes in how much pain you feel from waxing. Transgender males who start taking estrogens demonstrate more sensitivity to pain. And in females who transgender to males, they start taking testosterone, they have lower sensitivity to pain. So, there is a hormonal aspect that makes the person more sensitive to pain. But the answer is not so straightforward. There are many psychological and social cultural aspects of pain that influence pain perception, pain expression, pain sensitivity, and pain tolerance in both sexes. We know that chronic pain is more common in women than in men. But there are some types of pain that are more common in men, such as cluster headaches. It is interesting to note that men and women respond differently to pain treatments. Well, how about age? The answer is not straightforward as you may think. There are many variables involved here. A meta-analysis of 31 studies looking at pain thresholds and 9 studies looking at pain tolerance was published in 2017. The authors found that pain thresholds increase with age, especially when the scientists use heat as a stimuli and it was applied to the head. In contrast, pain tolerance thresholds did not show any substantial age-related changes. So, these two factors, genetics and age, we cannot modify. What about some factors that are modifiable? Is there anything we can do to modify how sensitive a person is to pain? That's where the science is very interesting, because the answer is yes. Pain scientists in various laboratories around the world found a lot of factors that modify how the person perceives pain. There are things that increase the perception of pain and things that reduce the perception of pain. In the laboratory, the scientists will try different things to provoke pain. And they notice that sometimes they are applying a very tiny stimuli, something that the majority of people would not regard that as painful. But depending on how they present the situation, the person will say they are feeling a very intense pain. Or the opposite, the scientists will apply a stimuli that the majority of people would say it's very painful, but they change the presentation in a manner that the subject will say, no, it's not hurting that much. Well, before I explain what are the circumstances, let me tell you a story. Many years ago in England, there was a construction worker. He was 29 years old at the time. He was wearing his protective boots, but he jumped down on a 6-inch or 15 centimeters nail. The nail went all the way through his boots, transfixing him on the spot, and was visible on the top of the boot. He tried to remove the nail, his co-workers tried to pull it down, but any movement caused terrible pain. His friends brought him to the local emergency department, and they had to sedate him with midazolam and fentanyl. Midazolam is a benzodiazepine to calm him down, and fentanyl is a potent painkiller opioid. Well, they were able to remove the nail, remove the boot, and to their surprise, the nail had not even scratched the skin. It had passed between his toes. Who will say that his pain was not real? Of course he felt pain, but here his brain felt pain even without the actual damage to his body. So this is what happens in laboratory too. If the person believes that they must feel pain, that their body is in danger, and that they need attention, the pain will be very intense. Even with a little touch to the skin, with a little pressure, even if the temperature of the probe is not too hot or too cold, if the brain believes that there is a potential damage, it will create pain. The contrary is also true. If there is real injury, but the brain does not think that there is a danger, the brain will not produce very intense pain sensations. I have a counterexample to the construction worker that I mentioned earlier. Well, earlier this year, on a Sunday morning, I went to church, and my colleague who plays piano had one of his hands in a cast. I asked him what had happened, and he told me he was working in a construction site when a co-worker used a nail gun and the nail went straight to his hand. Here's the picture. He was wearing his protective glove. I asked him how much pain was that, and you know what was his response? 0. He said he didn't feel pain, not even after he saw the nail on his hand. When they were trying to pull the nail, he felt pain, but they couldn't because it was stuck in the middle of the muscles of his hand. So they brought him to emergency, gave him a local anesthetic in the hand, and removed the nail. He showed me his x-rays. So for some reason, my friend did not have intense pain when there was an actual damage to his hand. I asked him what he was thinking when he said, I could see it was just a nail and I knew someone would be able to remove it. So his brain actually did not send messages of danger. Therefore, he didn't need to feel intense pain. Okay, let's go back to our scientific experiments. What did scientists discover about how we can change our sensitivity to pain? The number one is expectation. In almost all scientific studies, if the subjects were expecting pain, then no matter what the scientists did to their body, almost all of them felt pain. Now, if the scientists told them it was not supposed to hurt, the experiment would be a piece of cake, that there would be no danger to their bodies, then almost everyone did not feel pain. So next time you feel pain, ask yourself, what was your expectation? In the case of the construction worker with the nail in his boot, his eyes were telling him that he was supposed to feel pain. Look at your feet. You can see the nail. All of your coworkers are horrified of what happened. You are expected to feel pain. Next time that someone shows you an X-ray of your body, a CT scan or an MRI, try not to be primed by these images. Actually, try to avoid looking at the images, because if your eyes look at them and your brain determines that you are supposed or expected to feel pain, chances are that your brain will sound the pain alarm. Well, if you like this video so far, subscribe to this channel. What else besides expectations can alter the sensitivity to pain? The scientists came to the conclusion that the stress levels and anxiety can alter the pain sensitivity. So, how did they do this in laboratory? They did experiments with volunteers where they kind of stressed them out before they applied the painful stimuli. This could be showing them a sad or happy movie, or telling them a sad or happy story, and in the most cases, simple cases, just showing different colors. Did you know that red color stresses our brain and blue color calms it down? Yes. So when people were exposed to red colors prior to the painful experiments, they felt more pain. And when they were shown blue colors, they felt less pain. Mind you, the painful stimuli were all the same. They didn't change the intensity. Red colors remind us, our brain, of blood, fire, danger, risks. And blue color reminds our brain of the skies, ocean, waters, rivers, peace, and healing. So next time you feel pain, think about your emotional state. Are you in a situation that your brain is under stress and risk? What is going on in your mind at the time you feel pain? If you're having a bad day, you heard some bad news, you're anxious, nervous, stressed out, your brain will tell you that your pain is very intense. Is there anything you can do to change your mindset? Can you try some relaxation, talk therapy, praying, listening to music, singing, journaling, or mindfulness? This brings me to the next factor that changes pain sensitivity. Can you guess what it is? Attention! Yes. How much attention the person pays to the pain sensation actually increases or decreases the pain intensity the brain feels. Scientists provoked the same intensity of painful stimuli to volunteers, and in some circumstances, they distracted the brain. And when this happened, the person gave scores that were much lower than when the scientists asked the person to focus and pay attention to the painful stimuli. That's why we use distraction as a treatment for pain. It actually works. Examples of distractions are doing some tasks like walking, dancing, cooking, shopping, watching TV, writing, playing an instrument, or video games. In some cases, there is also virtual reality devices that help the person to be submitted to a minor surgical procedure with much less sedatives or painkillers. The next factor that changes pain sensitivity is very interesting. Can you guess what it is? Well, it's related to who is around the person feeling pain. Yes, scientists have shown that if the painful stimuli is given to someone who is alone, isolated, and feeling abandoned, they will be more sensitive and will report higher levels of pain intensity. Now, if they have someone with them, especially if this person is someone who is significant to them, like a spouse, or even better, if they hold hands with their loved ones, they report lower pain levels. So if you're feeling pain and your pain is unbearable, very intense, think about this. Are you feeling this pain more intensely because you are socially isolated? Are you feeling lonely and you don't have anyone who really cares for you? Your pain is real, but the social isolation might be amplifying the sensation. It's really important to make this distinction, because if you tell your doctor your pain is very high and intense, they may prescribe you treatments to lower your pain, but in fact, these treatments may not work. because they will not reduce the social isolation pain. There are some health and mental health problems that make the person more sensitive to pain. This can be chronic illnesses like migraines, fibromyalgia, for example. Some mental health diseases like depression and anxiety disorders also alter the person's pain sensitivity. Smoking also alters the pain sensitivity. Alcohol use, drug use changes how the body processes these painful sensations. So you might be thinking, can you do something to raise your pain threshold and pain tolerance? There are some studies with mental health exercise. They showed that this mental imaging exercise were actually helpful to manage their pain. Here's an example of a mental imagery exercise. Next time you feel pain, imagine your pain has a pulsating red ball. Then slowly change the color to blue and shrink the size of the ball. Do this a few times. Another exercise that is helpful to reduce the painful sensation is to reduce the stress and fear of the pain by practicing breathing exercises. I have some examples in my channel of a 4-square breathing and another video of vagus nerve exercises to activate the parasympathetic nerve system. Watch my video 71 for square breathing and 87 to activate the vagus nerve. A study in people with chronic pain and post-traumatic stress disorder (PTSD) showed that regular exercise increased the pain tolerance. Usually, the type of exercises are aerobics and resistance training. Another study showed that people who regularly practice yoga have a higher pain tolerance, and yoga also appears to reduce anxiety and distress associated with pain itself. Another interesting study showed that vocalization, like saying ouch or just making a noise when the person experienced painful cold water in the laboratory experiment, was helpful. They could tolerate the cold water longer when they vocalized their pain. Now, is there any problem if a person has a very high pain threshold and high pain tolerance? Maybe they will hurt themselves and not notice it, or they will have a disease and will not seek care. There is a rare genetic disorder that the person is born with the inability to feel pain. Fortunately, this is a rare condition because the person does not take the proper measures to protect themselves, and they suffer many injuries that can be very serious or even fatal. A person with a very high pain threshold and high pain tolerance may have similar problems. They don't feel pain so intense and they are not bothered by pain. Therefore, they may have a serious condition and do not seek proper care. On the other hand, people who are more sensitive to pain, those with low pain threshold and low pain tolerance, may seek too much care. They may be exposed to unnecessary tests, investigations, drug treatments, injections, or even surgeries. Because pain is a subjective experience, people experience pain differently. We don't know how the person is feeling, how much they are suffering, because we are different. Pain is what the person tells us it is. We don't have a thermometer to measure pain. You may watch my other video about the differences between acute and chronic pain here. If you like this video, give a thumbs up here, and thank you for watching. Goodbye!